Hi there, I hope you're doing well and I hope everything is going well for you. Welcome to Elevate Nursing, where we share professional development resources for nurses and midwives, both students and practitioners. Now, particularly today, welcome to the Elevate Nursing podcast. At the Elevate Nursing podcast, we share these resources continually and interviews with different professionals within the healthcare field and without. But particularly today, this is the Medical Mondays show. Now, Medical Mondays is a weekly program that presents on Monday mornings and where we share with you professional development resources, but particularly educational resources. And that presents our disclaimer. With the Medical Mondays show, the resources we share are snippets of medical conditions, terminologies, and so on, exclusively for nursing and midwifery education. It is not medical advice and should therefore not be used as such. So let's get into it. This is the first where we are presenting it via video as well, as was promised in the beginning of the year. Here we are. Today we are looking at metabolic syndrome, and if you would like to listen to other episodes that we have presented before, we have looked at cardiac conditions and kidney diseases and so on. With that, today we are looking at metabolic syndrome. Now, metabolic syndrome is a multifactorial disease. It is a cluster of conditions that increases the risk of type 2 diabetes and cardiovascular diseases. And basically the concept of metabolic syndrome, it comes about due to an abnormal deposition of adipose tissue or fatty tissue in the body. And factors that increase the risk of metabolic disease include particularly lifestyle conditions, but there are other pathologies that may be related. And if we look at that in terms of a sedentary lifestyle where individuals are not physically active, or dietary factors where the food that is consumed basically is not healthy and it is consumed in large amounts. With that, metabolic syndrome presents a risk of type 2 diabetes, cardiovascular diseases such as stroke and so on, and hypertension as well. And the major management method for metabolic syndrome is lifestyle change, but there are other management methods that are outlined for this condition. We will look at it more in future. Today we are looking briefly at the introduction. And with that, I hope that you have taken home something from this, or if you have taken a note of metabolic syndrome, you can go ahead and read more about it. As we strive to present evidence-based resources, we will have references for this in the description box, and I hope that you find it useful. I'll see you next week, and until then, Elevate Nursing. Take care. Bye-bye.